For people with chronic medication, missing a dose is not advisable, right? So we want to ensure patient protocol adherence continues in a great manner. Likewise for diagnostics. If a doctor has told you to manage your blood glucose levels and measure them once every quarter, we will be there to ensure that you don't miss on all of these.
Hello and welcome to the Masters of CX. We have a very special guest with us today, Siddharth Shah, the co-founder and CEO of PharmEasy. And when you are in a sector that's as busy as healthcare, it's never easy for PharmEasy, right?
Yes.
So Siddharth, welcome.
Thank you.
Thanks for taking out the time.
Thank you.
To start, I would like to know from a CEO's point of view, when you're setting up the business, when you're scaling it up, and then also pivoting from being, a pharmacy to a healthcare services provider, how important is CX in this entire scheme of things?
Look, I think if any company is not putting customer at the heart of their solution, then it's not really going to be a great company, right? So I don't know what else to say. I think especially in healthcare, it becomes very sensitive because you're not just dealing with a customer as in a customer, but a lot of times customer as in a patient, and therefore the level of care and empathy and concern that you need to show is literally above and beyond. And I think our team takes immense amount of pride in ensuring that we are the most accessible, the most affordable, the most authentic, the most caring organization for the customer or the patient, as the case may be.
Today, when we look at this game of, online commerce, quick commerce has stolen the thunder.
Right.
However, in your business, right from day one, timing was extremely critical, right?
Right.
The quicker you delivered the medicines, people were even more happy.
Right.
So how did you kind of play this game right from day one?
See, I think we have to understand that along with timing, authenticity also is exceptionally important in our sector. It's estimated that 1 in 6 medicines in the country, by the time it's sold to the customer, loses its potency and efficacy either because of either it's fraudulent manufacturing or bad storage. Now, players like us that barcode every single medicine with a unique QR code and allows complete integrity in the supply chain are actually giving a fabulous experience. You also have to realize that medicine is needed by everybody from cradle to grave, whether rich or poor, urban or rural. And in lots of rural, semi-urban parts of the country, you did not get access to the entire spectrum of medicines. You only had access to a few types of medicines, right? And again, we have a great role to play in accessibility. Last but not the least, in terms of affordability, I think we've done a fabulous job of providing medicines at a very, very affordable rate to a large number of patients. And obviously comes the question around timing, right? And so I would say that we are therefore one of the few categories where accessibility, affordability, authenticity, and time to market is important. And I think we pride ourselves on all of these innovations. And in fact, if you see, we are the first player in the country today in partnership with Swiggy Instamart to offer medicines under 10 minutes, right? So I think PharmEasy has been at the forefront of every single innovation to take care of all the customer needs.
Okay, so since you mentioned about 4 parameters, how do you map these parameters internally, and how quickly do you revisit or re-engineer processes so that you are like always ahead of the customer?
Look, I think authenticity has zero margin of error.
So
right?
zero tolerance.
Zero tolerance for fake medicines, right? And therefore we buy all the medicines from our manufacturer, right, or authorized distributors. So zero tolerance for fake medicines, and therefore authenticity is 100% taken care of. In terms of accessibility, I'm very proud to share that we deliver to more than 93 or 94% of zip codes in the country. Okay. We deliver to every single district in the country. We provide our products to every single state, every single union territory in the country. And in fact, not just products, let me also take a minute to talk about the wider spectrum of healthcare services that we provide. Let's say our diagnostics. If you take the map of India and put a pin, within a 200-kilometer radius, we will have a pickup or a drop-off center for our diagnostics. We are the only laboratory in the country where 100% of the samples are processed in NABL certified labs. NABL is given only to the top 2% of labs in India. No pan-India chain has that facility. and yet we process over 4.5 lakh patient samples a day, right? So I think in terms of accessibility, we are constantly innovating to get to our patients sooner and faster. In terms of affordability, I think PharmEasy for medicines and ThyroCare and PharmEasy Labs for diagnostics is known to be amongst the lowest cost providers, not just in India but in the world. And that leaves the last point in terms of the timing. And I can only say that we're delivering medicines under 10 minutes via Swiggy's partnership. And if you opt for diagnostics, if you go on PharmEasy Labs, you can actually request for a slot in as soon as a 60-minute time. And we are the only provider in the country that gives 100% guarantee of either on-time experience or free tests. So if your test does not happen at the predetermined time which we've told you, your entire test is free, not 10% off, 20% off, but 100% off. And I'm very proud to share that our SLAs on that are over 99.7%, right? So I think we are at the forefront of all kinds of consumer experience, and every parameter is of utmost importance to us.
Okay, now India is a country which is unpredictable, right? Traffic conditions, weather, etc., play havoc. However, in this sector, timing is crucial. So how do you then kind of balance it out? Because when people need critical kind of, maybe you need medicines at the nth hour, or you need a test to be done very quickly, a lot of variables are at play. How have you fine-tuned the act of managing consumer expectations?
So I think, look, we are always very clear that if a consumer has an emergency, they should not wait for us to arrive, they should go to a doctor. Right? I think, and that's true not just for us, but for anybody. We are not an emergency services provider. Let's be very clear. And therefore, it's important for us to know what we can do and what we can't do. And the first rule of customer experience is to set expectations clear and be very clear in terms of what you can and what you cannot do. And the customers appreciate that. You cannot be everything to everybody. Having said that, I think with our innovations on quality and speed, we are trying to get to the customer as fast as possible. Mm-hmm. But if customer has chest pain, I don't expect him to place an order on PharmEasy for a statin, right? I expect that they'll call an ambulance or the relatives will take them to the hospital, right? And I think we are not a hospital, we are not an emergency services provider. But having said that, on the same parameters, affordability, accessibility, authenticity, and speed, we want to be as fast as possible for the customer.
Okay. Moving ahead, now a lot of studies, including I think one from McKinsey, has spoken about predictive analytics playing a critical role in kind of managing customer experience moving forward. How do you use this? I'm asking you particularly because you mentioned earlier on about the cradle to the grave kind of service that
right.
healthcare service providers are associated with. So how do you get your predictive analytics right and not oversell, particularly when consumers pass on?
So I think the beauty is that analytics in my view and AI in my view has the highest role to play in healthcare. Mm-hmm. I think the role is that two very different kinds of ends of spectrum in terms of providing care. One, your AI will help you bring new drugs, new research on rare diseases and find treatments and breakthroughs. The second is the power of AI and analytics in terms of helping a vast number of people get access to more personalized healthcare. And let me give you an example. We just published a study with over 19 lakh patients on the correlation between your food patterns and causation between food patterns and diabetes. Mm-hmm. The previous study which was done was with 20,000 patients.
Right.
We did not do it with 10% more or 20% more. We did it with 100x more, a factor of 100x. Yeah. That can only happen when you have the power of technology to be able to get this in place. Today, if you come onto the PharmEasy platform, if you've done your test a number of times, you won't just get your report. You will actually have an AI assistant which will explain to you longitudinally what has happened. Correct. So if I can get a correlation that this is the movement of my HbA1c over a 3-year period of time, I actually know that, okay, with higher blood glucose levels, maybe you'll have challenges with your retina, maybe you'll have varicose veins, maybe you'll have this, maybe you'll have that. And that is what you want to do. You want to get the entire spectrum of symptoms, findings, diagnosis, testing, treatment. All of that, while it is the doctor who has to take the final call, but you can use the power of AI to aid the doctor aid the consumer in terms of understanding, prescribing, and going into the treatment. And I think that is where we are using it to the fullest possible extent today on our platform.
That's amazing to hear. Okay, and could I add with wearable devices and proactive monitoring of health gaining increasing traction, at least among a small set of consumers? Are you in that space as well, where people need not come to the platform, but the platform is proactively giving them?
So we've made investments in some of these platforms, like B2, for example. And the idea is, while we may not make the devices, all of the data that comes from the device helps you monitor your health in a much better manner,
Exactly,
right?
yeah.
You're not just trying to count your calories and footsteps, but you want to correlate that to your diagnostic test, to your treatment medications, and therefore provide a large number of variables that go into helping you get the best possible outcome with your doctor on your health, right? So I think it's just one more very interesting variable that can be woven into understanding how your body is and ultimately towards the goal of better health.
The other point that I wanted to raise was about frictionless consumer experience. When you straddle the physical and online space, how do you then manage a customer experience from the back end right till the point of delivery? How do you ensure that it's seamless?
See, our understanding is that once a consumer is on our platform, right, and let me take you examples both of medicine delivery and diagnostics. Once you come on the app to request a medicine, and once you uploaded your prescription, we are actually giving you one-stop checkout, right? Because if I have your prescription, I know what you need. You need not give that to me again and again. In fact, we'll help you and tell you that, hey, you know what? You may be out of these medicines because I know your prescription. I know that you need to take these medicines twice a day. And if you ordered 60 tablets, it's likely going to get done with the end of 30 days. And I don't want you to miss that dose, right? Because the biggest problem in India is people will typically wake up and say, shit, I'm out of my medicine. Now what do I do? And for people with chronic medication, missing a dose is not advisable, right? So we want to ensure patient protocol adherence continues in a great manner. Likewise for diagnostics. If a doctor has told you to manage your blood glucose levels and measure them once every quarter, he will be there to ensure that you don't miss on all of these. Now, these may seem small things, but you expand this at the level of 40 million registered users, suddenly, you are solving a very, very complex challenge, right? And actually making the customer's life exceptionally easy. And the beauty is not just the consumer placing the order on the app, but the beauty is actually getting those medicines in a ice cold temperature control box if you order insulin in 3 hours or 2 hours or 1 hour, or for the phlebotomist to show up at your doorstep at the pre-appointed time, right? I think it's the magic is not just done by the 300 people of our tech team, but actually by the entire 13,000 member execution team along with them, who all work together to provide the seamless customer experience.
Okay, how different has been the PharmEasy Plus experience as opposed to the regular PharmEasy experience?
See, I think the PharmEasy Plus program is meant specifically for consumers who especially have chronic healthcare challenges and want a unified single interface from a partner who will help them in their 360-degree healthcare experience. So we want to be the trusted outpatient healthcare partner. And what that means is, from your needs for information to your consultation with doctors, to your testing, to your treatment, we will be there with you all through in the entire journey, right? And this is what happens as a patient. If you're unwell, you'll seek information. Zyada bimari hui, you will maybe go to the doctor for a consultation. The doctor will request that you go for some test, and after the testing, you will basically get your treatment, which is your medicines, protocols, so on and so forth. We want to be a 360-degree partner for you in helping you manage your overall health, and the focus is on that. And I think the fastest adopted part of our business, or the fastest growing part of our business, is the PharmEasy Plus program, where we believe that we are the true partners to the customer, and customers see true value in us being partners to them.
And what percentage of your customer base is now enrolled for?
I don't want to go into the specific numbers, but I can tell you that today almost close to half our revenue actually comes from our PharmEasy Plus and Power users.
I have also, as a customer, experienced PharmEasy and seen that dark stores are sometimes really far away from your residence. As a result, you choose to kind of go to the neighboring pharmacy as opposed to wait for, a PharmEasy to deliver. How have you kind of fine-tuned your strategies? and made dark stores closer to consumers?
Look, I don't think it's a question of dark stores. I think our model is a little different compared to the others. Our model is that we buy medicines directly from pharma companies. We have about 1 lakh retail pharmacies in India that buy medicines from us. We actually map the pharmacy that has the inventory or that is buying medicine from us, and your demand maps them or matches them, and that is in the kind of the marriage between the pharmacy and you happens as a patient, right? See, this is not a case like where you have 4,000 or 5,000 or 10,000 SKUs and it happens. When you upload a prescription, you could have requested for any medicine under the sun. I don't know what you're going to ask for.
Yeah.
I can't tell you that if I don't have Coke, please take Pepsi. If I don't have Pepsi, please take Sprite. I can't tell a guy who needs atorvastatin, sir, please take Crocin, because that is available nearest to you. So that is not how this works. So therefore, we don't actually work with the concept of dark stores. Our belief is that there are 1 lakh retailers in India who are buying medicines from me. Most of these retailers sell it to customers that walk into their store. Some sell it to hospitals, some sell it to doctors, but there are some who say, I also want to be listing on PharmEasy. So it's one more method that we are giving them in order to get listed. But with a combination of distance and availability for your specific medicines, that store gets assigned to you. Right? And it's not necessarily a concept of a dark store. And therefore, sometimes you might find that the medicines get delivered in 10 minutes, as is the case with Swiggy, and sometimes it may take 3 hours also.
Yeah.
But like I said, we are not looking at ourselves as the emergency medicine provider. But if you are generally going to request for a medicine that is more commonly used, you'll maybe get it in 10 minutes. Sometimes it may also take 2 to 3 hours to get it delivered.
Wow. And how do you manage customer experience in that space? Okay, where how do you then explain it to the consumer that, this is... So what have you done proactively to kind of
Again,
tell people?
setting expectations, correct.
Exactly.
When you place an order, you will know exactly how long it will take. Alright, I'm not going to lie to you that, this medicine will come in 10 minutes and take 3 hours.
Yeah.
And I also won't tell you that it will come in 3 hours if it's actually going to come in 10 minutes, right? So when you order in PharmEasy, you will not just know whether it will come today or tomorrow. It will also tell you in how much time will you get the medicine. So you know from the product description page itself, you'll know how long will it take for the medicine to arrive. And therefore, customers will know upfront what is happening. And please imagine the amount of data crunching that's happening. We're actually looking through the entire inventory, the availability, mapping, delivery guys, all of that, and then coming to you saying that this is going to be the delivery time for you as the end consumer basis your existing address.
Okay, and to go back to the entire process of buying from the platform. Now we see as this is a problem across platforms, is search on the platform. So you're searching for something and the results that are thrown up are very different. How have you fine-tuned your platform to actually map it?
So I think our search, in my view, is by far the best possible within the healthcare space. And I think it only comes with your understanding of consumer experience and consumer delight.
Right.
And let me give you an example. See, when you want to buy a Coca-Cola, you know what is a Coca-Cola. When I tell you that you need to take rosuvastatin, most people will not know what is a rosuvastatin or the brand of it, right? I mean, meri dadi ko she'll know blue dawa, red dawa, yellow dawa. So when you are typing, you don't know the spelling, you may not necessarily know what it is not, right? And therefore, the first job is to try and show you things which are relevant to your disease profile. And number two, there is also a very big layer in our thing that without a prescription, you cannot get a medicine.
Correct.
Today, unfortunate reality of the life is that if you walk into most physical pharmacies, you will get any medicine without a prescription, even if it's an antibiotic.
Yeah.
And I think the government is doing a great job in trying to curtail antibiotic resistance and actually enforce the need for a prescription on physical pharmacies. But on our platform, without a prescription, you will not get the medicine.
Correct.
So your search and your prescription, only when it matches is when you get the full order, right? So we are not just 100% compliant in terms of prescriptions, but we can ensure therefore that there is zero error and zero medication challenges that you face as a customer.
Okay, and final question. If you had to prescribe, 5 simple rules to ensure customer delight and a great customer experience, what would they be?
5 rules, okay. I think number 1 is set expectations clear.
Yeah.
Don't take your customers to be fools. Don't overpromise and underdeliver. Set them clear. Number 2, along with speed, also focus on a great customer experience. And great customer experience, like I told you, in our case is not just speed but affordability, accessibility and authenticity. People look through that. Number three, if you have a great product, try and see how you can create a moat on a 360 degree around all the customer needs, like it is happening in the case of PharmEasy Plus, that we are not just trying to give medicines or diagnostics in a disparate manner, but looking at the whole 360 degree experience in terms of what you want. Number four, ensure that you get the customer a promise that if you don't deliver on, the customer feels that you are owning up to it. Like in the case of our diagnostics, if I don't deliver it on time or the phlebotomist doesn't come on time, the entire test is free. So therefore, everything that you then say comes with a lot of credibility, because the customer knows that if you don't deliver on it, you will take it back. And number five, continuously keep on iterating, right? I mean, you continue to excel in terms of what you can do for the customer. We went from same day delivery to few hour delivery to 10-minute delivery. If you do not keep on innovating, the customer will lose interest with you, right? So those are my 5 rules for great customer engagement.
Brilliant on that. Thank you very much, Siddharth, for joining us at the Masters of CX.
Thank you.
Would love to kind of keep in touch with you.
Thank you so much. Thank you.